All right, today we're going to follow the incredible story of this tiny little nerve that has just one simple job. But here's the catch. Its journey from the brain to the eye is so dangerous that when it fails, it becomes this huge warning sign for some of the most serious problems that can happen inside our skull. Think about it. It's a movement you do thousands of times a day without even noticing. You glance over to check traffic, you follow a conversation in a room, you catch something out of the corner of your eye. But have you ever really stopped to think about the delicate, precise wiring that makes that simple outward flick of your eye even possible? Because when that wiring breaks, the result is instantaneous and completely disorienting. Your whole world just splits in two. A single object suddenly becomes a confusing pair of images. And this isn't a problem with your eyes. Nope. It's a problem with the one nerve that controls one single crucial muscle. So what is going on here? Okay, first up, when your gaze goes wrong. We're talking about a condition that's so specific, this sudden blast of double vision, that a good neurologist can often spot the signs from clear across the room. So imagine a patient comes in and their main complaint is that they're suddenly seeing double. This isn't just, blurry vision. It's seeing two distinct, separate images of everything. And that one specific symptom, diplopia, immediately tells a doctor they need to start investigating the complex nerve highways that control our eyes. So what does that actually mean? Well, diplopia happens because your two eyes are just not pointing at the same spot anymore. They've totally lost their coordination. One eye might be looking straight ahead, but the other one has gone rogue, and it's sending a slightly different picture to the brain. And your brain just can't merge them into one clear image. And in this case, the eye can't look outward, toward your ear. Instead, it gets pulled inward, toward your nose. And why does this happen? It's because the muscles that move our eyes work in pairs. They're in a constant delicate tug of war. So when the muscle that's supposed to pull the eye out is paralyzed, the muscle that pulls it in has nothing fighting it. It just wins, and the eye drifts toward the middle.
So who's the culprit behind this muscular breakdown? Well, it's time to meet the star of our show today, cranial nerve 6. It's called the abducens nerve. And fun fact, its name comes from the Latin word abducere, which means to lead away. And that's exactly what it does. It fires up the lateral rectus muscle to pull your eyeball away from the center. A really simple job, but absolutely vital. And just to be clear, this isn't just some random nerve floating around. It's one of the 12 major pairs of cranial nerves that come directly out of your brain itself, not the spinal cord. You can think of them as the superhighways of your nervous system, controlling everything from smell and sight to your facial expressions and, you guessed it, eye movement. So that brings us back to its very simple but crucial job. Let's take a closer look at that muscular tug of war we mentioned. It's actually a pretty brilliant piece of natural engineering. So here's how the system works. On one side, you've got the lateral rectus muscle pulling the eye outward. On the other side, you have the medial rectus pulling it inward. The abducens nerve, it's the command line for only one side of this fight, the outward pull. And that right there, that perfectly explains the problem. If the signal from the abducens nerve gets cut off, the lateral rectus just goes limp. But the medial rectus, which is controlled by a totally different nerve, keeps right on pulling. With nothing pulling back, the eye is just helplessly dragged inward. The balance is totally broken. So why is this one nerve so likely to get injured? Well, the answer is all in its journey. It's anatomy. It takes one of the longest, most complicated routes of any cranial nerve, and this path is just filled with danger. I mean, just look at this trip. It starts way down in the brainstem. Then it has to literally pierce through the dura mater. That's the tough, leathery membrane around the brain. Then it makes a really sharp, hard turn over a ridge of bone. And then it has to travel through this crowded channel called the cavernous sinus, squeezed right up against the massive internal carotid artery. Every single one of these points is a potential disaster zone. So, at the end of the day, its own anatomy is its greatest weakness. Unlike other nerves that have a short, straight shot, the abducens is long, it's stretched out, and it passes through all these anatomical booby traps. This makes it super vulnerable to being stretched or compressed or damaged by all sorts of things. But here's the twist. That vulnerability is exactly what turns the abducens nerve into a massive neurological clue. Its failure is often the very first sign that something much bigger and scarier is happening deep inside the skull. And the list of things that can cause damage is just all over the place. It could be head trauma, like a skull fracture. It could be a tumor or an aneurysm pressing on the nerve. It could be an infection, like meningitis, or even a stroke. Because its path is so long, pretty much anything that increases the pressure inside your head can stretch it right to its breaking point. And this leads to a really fascinating puzzle for doctors, something they call a false localizing sign. It sounds a little confusing, but it's a super important concept for figuring out where the real problem is.
Okay, so here's what that means. Get this. A tumor or some swelling on the right side of your brain can actually push the whole brainstem down. That downward pressure can stretch the left abducens nerve over that sharp ridge of bone we talked about, causing a palsy on the left side. So the symptom, the left eye turning in, is on the complete opposite side of the actual cause. It can send doctors looking in the totally wrong place if they're not careful.
And that is why this little nerve is such a big deal. The abducens nerve basically acts like a super sensitive pressure gauge for what's going on inside your head. When it fails, it's not just some small problem with your eye movement. It's a critical alarm bell that's screaming at doctors to look for the underlying cause, which could be life-threatening. So a simple case of double vision ends up telling this incredible story of complex anatomy, delicate mechanics, and really important diagnostic clues. The risky journey of this one small nerve is like a canary in a coal mine for our brain's health. It's a powerful reminder that sometimes the smallest, most subtle symptoms can be our body's loudest warnings. It really makes you wonder, right? What other stories are our bodies trying to tell us, hidden in plain sight, just waiting for us to learn their language?